When we place breast implants, we can either place them above or below the muscle, and they each have their advantages and things to take into consideration. When placing them below the muscle, it's going to put a little more tissue on top of that implant, so it's going to help camouflage it better, especially that tall part of the implant, or the upper portion of the implant, where people can sometimes get rippling if they're too thin. Also, the capsular contracture rate's a little bit lower, not by a lot, but just a little bit. And what that is, that anytime you put an implant in your body builds a wall of tissue around it called a capsule. And usually want it to fit it like a glove, but not squeeze it like a vice. So we call, when it starts to squeeze it too much, a capsular contracture. So when you put it below the muscle, that helps lower that rate just a little bit compared to above the muscle. Now, one thing to take into account is when you flex your muscle, the implant may move a little bit when it's below the muscle. And we call that animation. And most folks aren't bothered by that, but that is something to take into account if you're going to place the implants below the muscle. Alternatively, we can place the implants above the muscle, and that's good for those folks that have thicker breast tissue that can really hide that implant without having to have additional layers of muscle or tissue covering it. One of the ways we can get around that, people that have thinner breast tissue, is we use a more cohesive or more of a gummy or gummy bear type implant where the gel is a little bit thicker. Now, one of the things to also take into account when it's above the muscle is you don't have to worry about animation or that effect when you flex your muscle, the implant moves a little bit. So for those folks that don't like the idea of the implant moving at all, above the muscle is going to be a better fit. In some studies, the capsular contracture rate is slightly higher above the muscle, though when I say it's higher, it's usually by a percentage point or two, but not that significant. So when we're deciding whether to put implants above or below the muscle, I'm going to take into account your lifestyle, what your goals are, and what kind of look you're trying to achieve.